This video details the surgical anatomy and technical demonstration of the freehand technique for C2 laminar screw insertion. A linear skin incision is made in the standard fashion for a posterior cervical exposure. The nuchal ligament is identified and the midline plane is formed. Monopolar cautery is used to dissect the spinous process of C2. The posterior elements of the cervical spine are exposed in a subperiosteal fashion. It is important to completely dissect the C2 lamina, shown here, including the superior and inferior limits. The superior and inferior borders of the C2 lamina are dissected using an angled curette. This allows for complete identification of the boundaries of the C2 lamina. In order to demonstrate the surgical anatomy of the C2 vertebra with respect to C2 laminar screw insertion, a 3D video is created using an STL file derived from an anonymized CT scan. The average C2 laminar thickness is approximately 5.7 millimeters. The spinolaminar junction is an important landmark for screw insertion starting point. The spinolaminar junction thickness is approximately 15 millimeters. This is an important consideration when using a crossing C2 laminar screw technique to ensure that the screw heads and the screw shafts do not interact. The direction of the C2 laminar screw placement is towards the contralateral inferior facet of C2. From the surgeon's perspective intraoperatively, the starting points of the left and right C2 laminar screws must be chosen before placing the screws in order to ensure that the screw heads do not interact. The screw should be placed completely within the lamina, angled towards the contralateral inferior facet, not violating the dorsal or ventral cortices. Once the borders of the C2 lamina are identified, the starting points are chosen bilaterally. A high-speed drill is used to make the pilot hole, and a curved pedicle probe is then placed along the inferior aspect of the C2 lamina in order to gauge the proper angle for screw insertion within the cortices. This pedicle probe is then inserted into the lamina to a depth of typically 25 to 30 millimeters. A small ball tip probe can then be inserted within the lamina. A right angle or snap is then used to determine the length of the screw able to be placed within the lamina. A tapered tap is then inserted within the lamina, and the ball tip probe is once again used to confirm intraosseous position. The screw is then placed. This process is repeated for the contralateral side. The starting point for this screw should be chosen at the most superior aspect of the C2 lamina in order to avoid interaction between the two screws. The curved probe is then inserted within the lamina. A ball tip probe confirms intraosseous position, and the lamina is again tapped and probed and screw placed. A successful technique for bilateral crossing C2 laminar screws puts the starting points of the screws at the superiormost and inferiormost extent of the spinolaminar junction. This ensures that the screw heads and the screw shafts will not interact. Rod placement can then be performed by creating a slight angle at the superior extent of the rod. This is placed within the screw head, both on the left and the right. If there is significant displacement of the rod from the C3 screw to the C2 screw, a lateral connector may be used.